medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what health care agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. We have three great guests tonight. We're going to start out with Dr. Dov Eidelaman. He's a plastic surgeon, and he also does breast reconstruction, Wellington Regional Medical Center. Then we're going to have on midway Dr. Andres Palacio, an endocrinologist with Tenet Florida Physician Services and Florida Medical Center. And then we're going to cap the evening with Robert Goodman. He's a MSW, so social worker, and he works with health organizations that need to become compliant with people with vision ailments. So we have action-packed program. I'm not going to waste any time, and I'm going to welcome Dr. Eidelaman. How are you doing tonight, Dr. Eidelaman?
Good. Thank you for having me, David.
Thank you. I appreciate it. And you're with Wellington Regional Medical Center. I know you have a few offices across South Florida, so I'm definitely going to share that with the listeners. But correct, you're a board-certified plastic surgeon, correct?
That is correct.
Now, tell us a little bit about your educational background. I'd like to start out there.
Sure. Well, a typical board-certified plastic surgeon goes through a lot of training. It starts with 4 years of medical school. I attended Albany Medical College. Then I spent 5 years in general surgery residency in Texas, and then finally completed 3 years of plastic surgery fellowship at Yale University.
Wow, so fellowship trained Yale University. Well. That's the way to cap it off there. That's great. Now, you have offices here across South Florida, and then also, I'm correct, you're on staff at Wellington Regional Medical Center?
Correct. Yeah, our practice has 3 offices, one in the West Palm Beach area on Congress Avenue. The second office is in Wellington, and our third office is in Jupiter.
Okay, we're here with Dr. Dov Eidelaman. He is a board-certified and fellowship-trained plastic surgeon. Now, I'm on your website now, plasticsurgerypb.com, so like the initials, palmbeach.com, plasticsurgerypb.com. And there's a ton of info. It's a great website. Now, I know you cover your areas of interest kind of stretches. So what is discussed at an initial consultation with a plastic surgeon? What goes on in that office visit?
Well, it can vary depending on whether we're discussing things for cosmetic reasons or for a specific medical issue. But typically for a cosmetic consultation, the discussion really starts with the patient's wishes. So we try to focus exactly on what the patient's concerns are. And then we move to their expectations of what they can expect to have treated. I spend quite a bit of time examining the patient, taking measurements, and then finally making my recommendations. My recommendations sometimes can mesh well with the patient's wishes and expectations, and sometimes they don't. And so we spend quite a bit of time discussing that.
So that's an important building block and first step in the process. Now, what procedures do you perform?
Well, for cosmetic surgery, you're really dealing with all areas of the body. You start in the face. In the face, you can have eyelid lifts, face lifts. You can get, which involve also neck lifts. And I also do procedures in the trunk and body, which, if you move down the body, you can work on the breast, which can involve breast augmentation, which is an enlargement of the breast or a lift of the breast. And you can also do arm lifts. You can do thigh lifts, tummy tucks. So quite a bit of a variety of cosmetic procedures.
And that's the cosmetic realm. Now, do you also do breast reconstruction as well? Like if someone, has breast cancer and has to have a mastectomy, are you able to help out and do a procedure that gives them back their look and their quality of life?
Yes, absolutely, and that's one of the things I really enjoy, because patients are so happy when we're able to restore a breast after a mastectomy, which can sometimes leave the body significantly affected. So breast reconstruction procedures are one of those things that I'm involved with. It typically involves working together with a general surgeon who will do a mastectomy or a lumpectomy, and then I get involved in the reconstruction process.
Now, can that be done at the same surgery time, or is it normally scheduled later as the individual recovers?
Well, what we've learned over the past several decades is that the best reconstructive results always start as early as possible. So immediately after a mastectomy, we try to begin the reconstruction process. Now, that reconstruction process can take one stage, or it can involve several stages until we achieve what we're looking for. And if it's done well, we can actually achieve better results than the original breast.
Oh, wow. That's great news. And that helps with confidence, right? You've seen in patients can help them with confidence and kind of maybe return back to a little bit of normalcy in life?
Absolutely. I think, the loss of a breast for a woman can be really devastating for a woman's self-esteem. And being able to help them reconstruct the breast is just a wonderful thing to see, because they still feel like their body part is preserved, and they can still wear clothing normally and feel comfortable with their spouse.
And we're here with Dr. Dov Eidelaman. He's a plastic surgeon and breast reconstruction specialist. And I gave out the website, and I'll do it again as well, at Plastic Surgery of the Palm Beaches. So it's plasticsurgerypb.com. Check out his About Us page. There's a ton of information of Dr. Eidelaman's credentials, areas of interest, etc. as well. His number is 561-968-7111. And I wanted to ask you, Dr. Eidelaman, a little bit about injectables, because we've been talking on the program a lot lately about them, and it's to my understanding, and the way I think about it is if I'm ever going to have an injectable or someone in my family, is I definitely would like to have a surgeon do it, or an MD or a DO, someone trained in the field. So is that something that you can do right in the office, injectables, laser treatments, that kind of med spa offerings?
Absolutely. I mean, injectables are very widely used throughout the country and the world. Pretty much the most famous injectable is probably Botox. Botox is something that patients always ask about. I typically spend quite a bit of time discussing with the patients what type of injectables to perform. So Botox works differently than other injectables because it actually stops the muscles from being active, which is a way of trying to keep the wrinkles from forming. So Botox is a product that is mixed in the office. It's tiny little needles, barely felt by the patient, and their main uses are mostly in the upper part of the face. So the forehead, in between the brows, and those brow furrows, or around the eyes and what we call the crow's feet. It's a very popular product. And it takes several days, usually up to a week, for the Botox effects to work, and it usually lasts up to, on average, about 3 months.
Oh, fantastic. And a little bit, can you tell us a little bit about laser treatments that you do? Because I saw in here something I don't know about is the profractional laser. Did I get that right? Yeah. Is that one of your areas of interest as well?
Yeah, our practice has several lasers that we work with on patients, mostly for the face. The profractional laser is a laser treatment done in the office. Patients come in, typically get some numbing cream that gets applied to the skin, and then we start the profractional laser treatment. And it's basically almost, if you think about drilling little tiny micro holes in the skin, and the process of the laser treatment will stimulate new collagen formation. So it's a very popular product, a very popular treatment for patients who have acne scars, because it will help out to smooth the skin. It also is very effective in fine lines of the face.
That's great news as well. Now, that can obviously help out men and women, because I'm sure you've seen an influx of men in the office over the last few years, no?
Yes, absolutely. I think over the past few years, we've noticed an increase in men involved in many cosmetic procedures, and it seems to be growing year by year.
And Dr. Eidelaman also does Juvederm and Sculptra and Kybella. Now, I want to ask you a little bit about cool sculpting. That's something that I'm hearing a lot about lately, and again, not sure. I have never had the procedure, but what is it used for? Is it used for around the midsection, or can it be used for other parts where there's fat in the body?
Well, it really needs to be tailored to the patient. So its most popular uses are around the trunk and the abdomen, and in those nasty love handles that we develop on the sides. So that's where its main uses are. But over the past few years, it's been used for some areas such as the area under the chin, and that seems to be a newer modality in its use. Cool sculpting is basically a process where we put a device over the area we want to treat, The device usually is about the size of 2 palms, so you're treating an area, that relatively small area. There's a suction device, and then there's a process of freezing the fat while you're in our spa, and the freezing of the fat occurs over about a 45-minute to 1 hour session. After that, the device is disconnected, and the skin is allowed to thaw out. And so what happens is, what we expect is that some of the fat cells will not survive the freezing process. And usually after one treatment, we can see maybe about 20% of the fat that's treated will have dissolved. You do need several treatments, typically about 4 to 6 weeks apart. So sometimes you have to do it several times. But the biggest advantage is that it can be done in an office without any anesthesia, without being in an operating room, and there's no incisions, no cuts, and it's just an external cryotherapy, so to speak. So it just freezes the fat, and then the fat that doesn't survive the freezing process just gets excreted by your body.
Wow, I didn't know that. You learn something new every day, and that's great for men and women. Dr. Eidelaman, tell the listeners where you do your plastic surgery procedures. Or I know I mentioned Wellington Regional Medical Center. Now, is there anywhere else?
Yes, so Wellington Regional is one of the locations where we do many of our reconstructive procedures and some of our cosmetic procedures. The majority of our cosmetic procedures are performed at our ambulatory surgical center. We're fortunate to have it fully accredited, and it's staffed by registered nurses and anesthesiologists. So we're very fortunate with that because it's done in a very safe environment.
That's great. Well, thank you so much for joining us tonight. I'm going to give out the information one more time, but please come back on the show in the future, and I really appreciate all the info.
Oh, you're very welcome. Thank you for having me.
That's Dr. Dov Eidelaman. So it's Plastic Surgery of the Palm Beaches, plasticsurgerypb.com, 561-968-7111. Stay tuned. We're going to be right back with Dr. Andres Palacio from Tenet Florida Physician Services. He's an endocrinologist and also at Florida Medical Center on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier. an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show, living a longer and healthier life. Now we're going to welcome Dr. Andres Palacio. He's an endocrinologist with Tenet Florida Physician Services in Fort Lauderdale, right on the campus of Florida Medical Center, a campus of North Shore. Everyone, the listeners, radio, and social media, Facebook Live should recognize that because we had your CEO on the program in December, Trey, so Abshir. So we really had a good time with that. But welcome to the program, Dr. Palacio. How you doing tonight?
I'm doing great, David, and thank you for having me in.
And thank you for coming with us on this health adventure, because we don't get to talk a lot of endocrinology often as I think we should, because it's really obviously the doctor that you see for diabetes and other endocrine disorders. But I'm kind of confused. Do we wake up in the morning and decide we need an endocrinologist and call you up, or is it something our primary care refers to see you?
So that's a very good question. So basically, when you think about endocrinology, it pretty much involves any gland in your body. And when I refer to glands, it compromises glands that start with your pituitary gland, which is the gland that controls mainly all the hormones in your body. It involves your thyroid. It involves your pancreas. So diabetes is there. And it involves both hormones from the male part of reproduction and also the female part of reproduction. When you look at younger patients, pediatric endocrinologists look at growth and development. So pretty much an endocrinologist can see you since you're a child until you're way ahead in your adult life. The other things that endocrinologists manage are hypertension, lipids, and osteoporosis,
in which we're going to get into a little more in the program here. I wanted to ask you a little bit about diabetes. I'm a big guy. I've talked to my doctor about it. Everything's good so far, but they're watching because of my size, try to lose a little weight. But I've shocked. I always knew about type 1 and type 2 diabetes, but as I've worked in the medical field as a PR manager and dealt with some patients and patient testimonials, I've found there's all kinds of different types of diabetes. Have I been pigeonholed in thinking type 1 and type 2, or are there many kinds of diabetes, and is it evolving? That's kind of a three-part question. But
totally. So in reality, the main types of diabetes, as you mentioned, are type 2 diabetes, and the main cause for type 2 diabetes nowadays is obesity. And the problem is we're seeing obesity and diabetes in young kids. And when kids get type 2 diabetes, they get complications sooner than when patients get it at an advanced age. What happens with type 2 diabetes? Your pancreas cannot produce enough insulin to control the glucose in your body. Then the other type is type 1 diabetes, in which your own body destroys the cells in the pancreas that produce insulin. So those patients require insulin to be able to survive. We have also gestational diabetes, which is any kind of diabetes that develops during pregnancy, and it has become very common, and that's also treated between gynecologists and endocrinologists. Other types of diabetes would be if patients have their pancreas removed, or if they have medications that can be toxic to the pancreas. Cystic fibrosis can give you diabetes. But as you said initially, the main types of diabetes are type 1 diabetes and type 2 diabetes.
Thanks for explaining that, because I've always been a little confused. And I actually witnessed the gestational diabetes. My wife actually had it. We have a 10-month-old now, and she had to check herself daily. And I really feel for the people with diabetes, because I actually saw it firsthand, and checking the blood. Help me out. What is that they're checking the blood?
So
the glucose, right?
We use glucose meters.
Okay.
And diabetes is one of the fields that has seen a greatest surge in technology. So nowadays there's a way to check your blood sugar without checking. So there's some devices which are called continuous glucose monitoring that will check your blood sugar every 5 minutes. And the FDA has approved 2 of them that don't require finger sticks. So diabetes has been evolving, and we're seeing now these technologies which we can use in our patients. And in a few years, 5 or 10 years, I'm pretty sure that we won't be having to stick our fingers, but we will be able to use or check the blood glucose using these new technologies.
Isn't that amazing? I mean, listeners and viewers, to just think that the way medical technology is moving, we're really in an amazing age for healthcare right now. We're here with Dr. Andres Palacio, and he is an endocrinologist at Tenet Florida Physician Services. Like I said, he is part of Florida Medical Center at campus in North Shore, and he has an office right there, 3001, so 3001 Northwest 49th Avenue, Suite 303, Fort Lauderdale. Did I get that right? Because you were on the first floor, now you're on the third floor, right?
Yeah, we moved this month. We're in a brand new office, and we're excited to be there.
And 2 other endocrinologists there, so this is an endocrinology practice.
So I have 2 partners, Dr. Ana Silva and Dr. Igna Krisiak, 2 very competent and very nice endocrinologists.
And both of them have been on the show, and I had 2 ladies first, and get them on. So I'm glad you could come on as well. And a big point there, bilingual practice.
Yeah.
English and Spanish.
And Dr. Silva has a Brazilian background, so also Portuguese.
Portuguese, wow, which we have a growing Portuguese population as well in South Florida. So that's a great endocrinology practice that you 3 are building there. So kudos on that. Another reason I wanted to have you on, this always comes up. I feel like I didn't even hear anything about thyroid 10 years ago. Now it's like in the news all the time. So what is thyroid disease, and why would we have to see someone like you to help out with it?
Yeah, that's a very good question. So basically the thyroid is what controls the speed at which our body works. The thyroid is a small gland that's located in your neck, and we've seen a huge increase in thyroid problems. When we see an endocrinologist, usually it's because of 2 things. One, there could be a mass in the organ. So we've seen an increased diagnosis of thyroid cancer, and we as endocrinologists treat thyroid cancer and thyroid nodules. So one reason why you could see an endocrinologist is because you have been diagnosed with a nodule in the thyroid. So we will do all the workup, and eventually, if you end up having thyroid cancer, we would also do the treatment for that. And the other reason could be because your thyroid is overproducing or not producing enough thyroid hormone, in which case we would call it hyper or hypothyroidism. And either of those medical conditions can be treated. We can give hormones, or we can slow down the hormone production within the thyroid. So it's very common to see patients with thyroid disorders, and an endocrinologist would be the doctor you should see if you're having thyroid problems.
That's good to know. And you started talking about the pituitary gland, and this, I only know this because isn't this the gland that starts puberty in boys and girls, and then also growth as well? Because I got to tell you, I was 6'1" at 12 years old and dunked a tennis ball on a wooden basketball court, and then I didn't grow another inch. I was a tall, skinny basketball player. What happened? Did I have my pituitary gland just stopped at 12?
No, so 6'1" is pretty good size. I'm 5'6", so I'm going to start crying.
Some people say I may not be 6'1". I never was, but I know I'm a hair over 6, okay?
So basically the pituitary gland is like the master gland. It controls the production of hormones in the rest of your body. So basically it controls thyroid, it controls the ovaries or the testicles in males and females. As you said, it produces growth hormone, and growth hormone helps kids grow, but in adults it also helps us with the feeling well, having stamina. It helps us preserve muscle. And the other hormone that's controlled by the pituitary gland is the adrenal gland. And the adrenal gland produces cortisol, which is like the stress hormone. It produces some sex hormone precursors, and it produces aldosterone, which is a hormone that helps regulate blood pressure. So it's a very small gland located in the brain, but it's like the main thermostat of all the hormones in the body.
Oh, wow. And cortisol, so is that the good stress or the bad stress?
So cortisol, as we have evolved as human beings, cortisol was made either to fight or run when we were under stress. What happens nowadays is that we're in constant stress. A lot of times cortisol levels don't fluctuate as they should. Basically, measuring cortisol can be a little bit hard, and there's, again, in endocrinology, there could be excess of cortisol, in which we have Cushing's syndrome or Cushing's disease, and there could be deficiency in cortisol, in which we have adrenal insufficiency or Addison's disease. And basically, neither of them are good for you, and cortisol is a hormone that's required for survival.
Thanks for explaining that, because I didn't want to ask about that, because I know stress levels can be high in society today with all that's going on, everything we're all trying to keep up with. I can't imagine being a doctor and having a family and life. I mean, and we've had 200 doctors on this program, and they really handle themselves well, so it's really a great group of human beings. We're here with Dr. Andres Palacio. He's board certified in internal medicine and endocrinology, diabetes, and metabolism. He does medical school at Universidad CES Science and Health Institute School of Medicine in Medellin, Colombia. Did I get that right, Medellin?
Yeah,
yes.
Got it right.
I really wanted to get that right. Internship at Emory University School of Medicine in Atlanta, Georgia, in internal medicine, and then residency at Emory University School of Medicine, also in Atlanta, Georgia, in endocrinology, metabolism, and lipids. Boy, you definitely put the time in education and training, and you're a very smart man. We're really glad to have you. I wanted to ask you about osteoporosis, because this is something I know a little bit about. I know my grandmother had it, and then that my mom has it now, so I'm maybe thinking maybe tying to genetics, but I'll let you explain a little bit. But is it weakness in the bones due to low calcium? I remember when my grandmother fell when she was like 65, she didn't fall very hard, and she broke her shoulder so bad, and I think the doctor came back and said osteoporosis. Is that weakness?
Yeah, so that's the perfect description of osteoporosis. Osteoporosis is weakness of the bones, and it's not only because of low calcium in the bones, but bones also have proteins, and those proteins can be weak. So osteoporosis can be because of a decreased composition of calcium in the bones, but also because of weakness on those proteins. It's like a bridge. It has columns, and some of those columns can get weaker as we age. The most common cause of osteoporosis is postmenopausal osteoporosis. So when women end up not producing sexual hormones, they start losing bones fast. But we also see osteoporosis in men, and a lot of times men are not, they don't know enough about the disease. What's important to know, David, is that osteoporosis is a very serious condition. If a patient has a hip fracture, there's a chance that they might die within the first year of 25%, and there's a very high chance, about 70%, that they will not be able to do what they used to do before having the fracture. So a lot of people, when they go beyond 70 or 80 years, a lot of them die because of a fracture. So I think it's a very important problem, and I think that a lot of times we don't have enough information about it.
Now, how can you manage osteoporosis? Is it something that medications, or is there other things that an endocrinologist can help with?
So, as all of our medical conditions, exercising is extremely important. Having enough intake of calcium and eating adequately is important. Being exposed 15 or 20 minutes on the sun early in the morning, or taking vitamin D, is important. And we have medicines that both help create new bone or they prevent bone loss. So there's oral therapy, there's IV therapy, and there's subcutaneous therapy with which we can manage osteoporosis.
Now, can men get it?
Definitely. So osteoporosis can be seen in men. And when male patients have osteoporosis, we always have to look for what caused the osteoporosis. Is it alcohol related? Are they losing calcium in their bones? Do they have high hormones that are causing them to have osteoporosis? But it's definitely a diagnosis that can be made in males.
I'll tell you what, endocrinology is really starting to amaze me. It really touches a huge part of the human body. I mean, it just, and I know you have a passion for it too. Now, this kind of, when I saw this on the areas of interest, I was, normally when we're talking lipids, I'm talking to cardiologists or heart surgeons. Endocrinologists can help manage lipids as well?
Totally. So when we do diabetes, we do diabetes, endocrinology, and lipids. So, for example, at Emory, which is the place where I trained, there was a doctor, Dr. Virgil Brown, who's one of the fathers of lipidology. So he was one of the persons who started the lipid movements. And basically, when we see diabetes, most of our diabetic patients have high cholesterol. So definitely lipids are part of metabolism, and endocrinology is the specialty or one of the specialties that's good at treating these kind of disorders, not only high cholesterol, but also high triglycerides.
And obesity as well. Now, I'm thinking, and correct me if I'm wrong, that maybe see an endocrinologist because of hormones, and that maybe can be one of the factors in obesity?
So obesity is a chronic disease, and that has changed because in the past we used to think that obesity was just something cosmetic. Nowadays we know that obesity can cause metabolic problems. What kind of metabolic problems? Diabetes, cholesterol, high blood pressure. It can also cause mechanical problems, so it can alter your joints, it can produce sleep apnea, it can worsen gastroesophageal reflux. So obesity is a chronic disease. Usually it's not caused by a hormonal abnormality. And I want to make emphasis on this. Everybody thinks that a person who has obesity, it's just because they want to have obesity. But in reality, everybody who's obese would not want to be that way. What happens is in the hypothalamus, which is a sensor that you have in your brain, when you gain weight, that hypothalamus prevents you from losing weight. And if you lose the weight, it's going to make whatever it can to try to make you regain the weight. So there's studies that patients, after they've lost weight and they're no longer in the diet, when they have their hormones checked, it seems as if their body was still dieting. So that's why when people diet and they lose weight, they regain the weight. It's because the hypothalamus and all the hormonal system is trying to make you come back to the initial weight that you had when you started dieting. That's why nowadays when we prescribe a weight loss medication, patients have to realize that the medication is for the long term. It's not a 2 or 3 month management. It's like taking a blood pressure or a diabetes medication. And that's why we're also doing a lot of surgery, because what studies have shown is that patients who undergo surgery have decreased mortality, and a lot of the complications that happen because of obesity improve after surgery. I want to point out that I don't do surgery myself. That's done by surgeons. But when patients have an excess weight or they have a disease that has been getting worse because of the obesity, a lot of times we refer them to surgery and then we do the follow-up.
So that's bariatric surgery as well. Now, I just want to thank you so much for being on the program. It's hard to believe that we got through all those questions, but that we're already up with time. But I want to have you back on the program in the future. I think it was really great to hear from you.
Oh, thank you for having me.
So I appreciate it. That's Dr. Andres Palacio with Tenet Florida Physician Services. His number is 954-714-0684. He's at 3001, so 3001 Northwest 49th Avenue, Suite 303 in Fort Lauderdale. It's about a 30-minute drive here from the Boca studio on a good day of traffic, maybe 40 on a bad day. But it's on the campus of Florida Medical Center, a campus in North Shore, a great hospital. Stay tuned, and we're going to have Mr. Robert Goodman on the program. He's a social worker. We're going to talk about vision ailments and his work making healthcare organizations compliant, helping them out on the You and Your Doctor show.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Debate with Lou out there.
And we're back on the You and Your Doctor, Living a Longer and Healthier Life. So the second portion of the program, Living a Longer and Healthier Life. And we have Robert A. Goodman, MSW, Florida Navigator. Mr. Goodman, welcome to the program. How you doing?
Thank you. Good today. Thank you.
Hey, and tell us a little bit about what you do, because we had a phone conversation, but you work with compliance, right, for people with vision ailments?
Well, I work with home health agencies and doctors' offices on trying to help them comply with the two federal laws, the Americans with Disabilities Act and the Rehabilitation Act of 1973, to help them comply with those laws as they apply to people with visual disabilities. By law, they're required to provide reasonable accommodation in the way they communicate with their patients. That means providing any written materials in large print, braille, or on audio. So you have, these doctors that give out, instructions for pre and post surgical or treatment. You have home health agencies that give out thick packets of material that, they expect the patient to go through. Patient with visual disability can't read that stuff. It affects their medical outcomes, and if they can't comply with these instructions and these directions, they can't read their follow-up materials, they end up being re-hospitalized. And the hospitals are charged millions of dollars in fines by the federal government. So what I'm trying to do is help healthcare providers prevent lawsuits, and I'm trying to prevent home health agencies from getting, they're called ACA tags, the Agency for Healthcare Administration tags, which are violations. So that's basically what I do. And I work with a graphic designer, and we can help companies comply with the law by providing in large materials, helping you convert your materials to large print. And at the same time, we also know other people that can do the braille or the audio if that's needed as well. And I've published a guide to people with visual disabilities on these laws. I've also published a guide, and I'm going to give you a copy of a handbook for businesses and healthcare providers on the law and complying with the law as well.
Very important, definitely, and getting that information out to this percentage of the population. Now, I wanted to ask you about percentage. What, in your opinion, do you know what percent of South Florida, in your mind, health companies are actually compliant? Is there a way of knowing that?
Not really. I would say less than 1%, though.
Less than 1%? That little?
Based on my experience
Wow.
of trying to get agencies to comply with the law, I'd say less than, maybe a little more than that, but I doubt it. A few agencies I've worked with are complying with the law. I was in need of home health care, and I asked one particular home health agency that was serving me for materials. And they gave me a book, like, I don't know, an inch thick of material information. I said, I need that in large print, and they refused to provide that to me. If I was a type of person who likes to sue everybody, I could have sued them very easily on state and federal levels for violations of my rights. But I'm trying to get them to, and others to comply with the law. If doctors' offices are supposed to give you your reports in large print, which is 18-point in Arial font, and they're required to give you any of the, when you're going for treatments or operations, they should be giving you materials in large print, or, in my case, large print. If you're going, a nursing home should be giving you their packets of material in alternate format. And hospitals should be giving you materials when they admit you. They give you a handbook sometimes. Delray Medical Center has a wonderful ADA coordinator there, and she provides everything in large print, Braille. They have the sign language interpreters. I mean, they do a great job there, as an example.
That's great to know. Definitely. Do you think that in South Florida in the U.S. that it's just almost like almost ignorance? People just don't know, or they don't take the time to learn that they need to be compliant?
Both. I think that they are unaware of that part of the law.
Maybe overlooked is what I was trying to get to.
The federal government in pulling out the ADA in 1990 and the Rehab Act in 73 really stressed physical accessibility for people who use wheelchairs and walkers and so forth. Our community, the visually impaired community, really has not been actively voicing our needs in this area. And I've been going to various visually impaired support groups to talk to them about the law and teach them about their rights under these laws. We produced a card they can give to their doctor that when they go into an office, if the receptionist says, "Well, I can't help you." Well, I'm sorry, you're required to help me, and you can't ask my wife to help me, and you can't ask some other family member to help me. You're required by law to help me yourself. I went to an optometrist office, and the receptionist refused to help me fill out the paperwork. The receptionist isn't there anymore.
Oh, wow. Okay.
I told the doctor what happened.
Very important. So a lot of what you do is advocacy, as speaking to community groups and the group like with vision impairment, like you said.
And I run the vision support group in Century Village, and it's very interesting. I always come into a meeting, I'll say, "Okay, how many know what the ADA is?" A few hands go up. I said, "Wait a minute, we just talked about this." So it needs a constant reminder to seniors about what their rights are under this law.
Definitely. Very important. Now, if a business or healthcare agency is watching or sees this later on, they can contact you, and like you said, you'll work with them, and you have a graphic designer that can then help them out.
I have a website, is DisabledAmericansAct.com, and they can reach me at rgoodlobby, that's RGOODLOBBY, at gmail.com, and the phone number is 561-465-2224.
Okay, I'm writing all that down, and we'll give it out. And that, again, is 561-465-2224.
Yes, sir.
And you can speak with Mr. Robert Goodman, and he'll help you out, get compliant with the correct term is for getting the literature out to people that are vision impaired.
Right.
Okay, now, I saw after your name, MSW, is that in the social worker?
Yeah, I have a master's degree in social work.
Oh, wow, okay.
And I know one of the questions you asked me is how I got involved in all of this. Well, I myself am legally blind, and a lot of the people I've worked with as a geriatric social worker, a lot of people I've worked with have gone to doctor's offices and home health agencies and have not received any materials that they can read after the home health agency staff leaves. So I got very involved in this. I've always been a disabled rights advocate anyway, my whole life. So,
well, that's fantastic.
You guys got other interests. I also collect campaign buttons.
Oh, yeah.
I have a large collection of campaign buttons going back to McKinley, and I also like to travel.
Okay.
I've been to 45 states.
Whoa.
And I've been to a number of countries in Europe.
Okay.
And Canada.
How long in South Florida have you lived?
All my life.
Oh, wow.
I'm almost native.
Almost native?
I came here as a baby.
Oh, okay. Where are you originally from?
Bayshore, New York.
Bayshore, New York. I'm sure we have
not
some
a New Yorker.
Listeners from Bayshore, New York, but maybe split time between here and there. I'm a native Floridian. I'm from Jupiter, but I'm so glad we have you down here. Now, explain to the listeners, maybe they don't know what the ADA is. So it's the American, I know it's...
Americans with Disabilities Act was passed by President H.W. Bush in 1990. And it basically, and the Rehabilitation Act of 1973 was obviously passed in 1973, and Section 504 of that law, they both require businesses, any kind of businesses, to comply with the law in providing this reasonable accommodation. The ADA applies to state and local government and to all businesses that serve the public and that provide any kind of communication with the public. That includes all healthcare providers. The Rehabilitation Act of 1973 applies to anyone receiving Medicare or Medicaid funds or any federal funds. So and it also applies to the federal government, the Rehab Act of 73, whereas the ADA does not apply to federal government. And it's interesting that the federal and state government are not even in compliance with this law. I did a survey in Palm Beach County of all the agencies when I do my health fairs. I run health fairs in Century Village twice a year. I'll be doing Kings Point next year as well. And when I do my health fairs, when I run the health fairs and so forth, I ask these agencies to come and provide large print, and only 4 out of all the agencies in the county had materials in large print, and those were disability-related agencies. The state attorney wrote me a letter saying, "We are full in compliance with the law." I wrote back, I said, "Excuse me, but you've only got 4 or 5 agencies that are in compliance out of all the agencies in the county." So they weren't too happy with me with that. But, if we don't make people aware of these 2 laws, and we don't make the healthcare providers aware of these 2 laws, then people with visual disabilities are only going to have more problems in trying to comply with medical orders and following up with home health care and so forth.
Yeah, that could definitely be a hurdle because the doctor gives you instructions in the office, but you always have that piece of paper or something to go back to. But if you can't get the communication off that piece of paper, it's useless. And something as simple as working with someone like you, and then you in turn explain that. So you work with a graphic designer and you give them a specific. You said 18-point Arial font.
Arial font, 18-point type is the standard for large print.
So that's like minimum, right?
Yeah, this is 22-point type.
Okay.
I'm showing you.
I see that.
18-point is the new standard. It used to be 16 and 14 at one time, but those are out of... The federal government uses 14-point or 16-point now, which is too small for most people to read.
Yeah. So 18-point Arial font
18-point Arial
is what
font
it's got to be.
It's preferred that way, yes. And not everything should be in bold. It should be, a mixture of bold and non-bold. There's a whole, again, on our website, you can be connected to the right other website, refer to the other website to get the information on exactly how to make things in large print.
I just want to explain also that your expertise is in printed material, though, because you mentioned the website.
Yes.
So brochures, paperwork that's given from the healthcare agency or doctor's office.
Yes, that's where I am, because I can't do Braille, and I can't do. Well, I do have somebody who can do audio, but we have names of other people that can do the audio and the Braille.
Okay, that's fantastic. Now, this is great news that I think can be helpful to anyone in the community, because we should all be in it with each other, and if you have a family member or friend with a vision ailment, and we got about 2 minutes, that this is something that should be brought up, because that information needs to be given. I'm actually typing in your website now. Now, how did you find a graphic designer that could listen to what you have to say and do it right?
She's very good, and we've worked together for many years now on my health fairs, and my materials have to be in large print for me. So
yeah, kudos to her too.
Yeah, she's very good, and she does graphic design for companies all over the country. So.
And where are you based out of? What area?
In Boca Raton.
Right here in Boca Raton. Now, do you serve Palm Beach County and Broward County as well?
I'll serve anybody, anywhere who wants to call me and get advice.
And that number is 561-465-2224, and it's Mr. Robert Goodman, MSW. So that's Masters in Social Work, which is very important. So you have the background as well.
Been a geriatric social worker for over 40 years.
40 years, wow. Well, thank you for your service and helping people out. I mean, this is of utmost importance to the community.
For consumers who are listening, when you go to a doctor's office, request large print. You go to a home health agency, request large print.
Yeah, it's your right, correct?
You're right.
Well, Mr. Goodman, I'd like to have you back on the program in the future and talk a little bit more about this, because this is something that everyone needs to know about.
Thank you very much for having me.
Thank you for coming on the Living a Longer and Healthier Life show, and we'll see you Friday at 5:30 p.m.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed